In the world of scientific discovery, some of the most profound advancements have come from accidental breakthroughs, serendipitous moments where chance and curiosity collide to produce something unexpected. Yet, for every success born from an accident, there are moments of discovery that led to unforeseen consequences, some of which are deeply unsettling. One of the most chilling examples of this occurred in the early 20th century, when scientists, in their pursuit of knowledge, accidentally created a deadly virus that would go on to change the course of medical history. The story begins in the 1930s, a time when scientists were beginning to explore the complex world of virology. Researchers were studying how viruses worked, how they spread, and how they interacted with living organisms. It was during this time that a group of scientists working in the field of experimental virology were investigating how viruses were transmitted between animals, with the hope that understanding these transmission mechanisms could help prevent disease outbreaks in humans. Little did they know that their work, which was intended to save lives, would inadvertently give rise to one of the most dangerous pathogens in modern history. The virus in question is the one we now know as the hantavirus, named after the Hantan River in South Korea, where it was first identified. However, the origins of this deadly virus go far deeper than that single discovery. In the early stages of research into the transmission of animal-borne viruses, scientists were experimenting with various methods of inoculating rodents with viral samples. The goal was to observe how the virus affected these animals, in the hopes of discovering ways to prevent zoonotic diseases from spilling over into the human population. As part of this research, they also experimented with various environmental factors, including temperature, humidity, and diet, to see how these variables influenced the way the virus was transmitted. But in their enthusiasm to advance their research, the scientists overlooked a critical detail by working too quickly, and without sufficient precautions. They inadvertently created the perfect breeding ground for the virus to evolve into something more dangerous. The viral strains they were working with were altered in ways they did not anticipate, becoming far more virulent and deadly than anyone could have imagined. It was a classic case of unintended consequences. The scientists' efforts to understand viruses inadvertently led to the creation of a more dangerous one. The new strain of virus began to spread in rodents much more efficiently than its predecessors. The scientists, initially unaware of the danger, continued their experiments without realizing the full scope of what they had created. The virus spread rapidly among the rodent population, and the rodents began carrying the mutated virus over vast distances, inadvertently becoming the vector for its transmission. This is when the true danger of the virus began to emerge, as rodents came into contact with human populations, particularly in areas with poor sanitation and close proximity to animals. The virus began to spill over into humans, causing what would become known as hantavirus pulmonary syndrome (HPS). HPS is a severe respiratory illness that, in its most fatal form, can lead to acute respiratory failure and death within days of infection. The virus is transmitted through contact with rodent urine, feces, or saliva, and can also be contracted by inhaling aerosolized particles from rodent droppings. The symptoms of HPS include fever, muscle aches, and fatigue, followed by difficulty breathing as the lungs fill with fluid. In many cases, the infection progresses rapidly, and victims can succumb to the disease within hours. The virus became notorious for its high mortality rate, which is estimated to be around 40% for those who develop severe symptoms. This made it one of the most deadly viruses to affect humans in modern history. What makes the story of hantavirus particularly alarming is the fact that it was entirely an accident. The virus wasn't deliberately engineered as a biological weapon or created through malicious intent. It was the result of a simple oversight, a lack of understanding of how viruses could evolve and mutate in response to environmental conditions. The scientists who were working on the virus were trying to make a breakthrough in medicine to understand how viruses spread and how they could be controlled. But in doing so, they inadvertently unlocked a new and deadly viral strain. Once the virus began spreading to humans, it quickly became apparent that the situation was far more dire than anyone had anticipated. As scientists and health experts raced to understand how the virus was spreading and how it could be contained, they encountered a number of challenges. The virus was difficult to detect early in its course, and by the time symptoms became apparent, the patient's condition was often so severe that treatment was ineffective. Because the virus primarily affected the lungs, It posed a unique challenge to medical professionals, who were not equipped to deal with such rapid and devastating respiratory failure. The outbreak of hantavirus in the United States in 1993 brought the virus to international attention. A cluster of cases in the southwestern part of the US led to an intense investigation by the Centers for Disease Control and Prevention (CDC). The outbreak was traced back to a specific strain of hantavirus carried by deer mice, and it became clear that the virus had likely been introduced to the human population through contact with rodent excrement. The discovery sent shockwaves through the medical community, as the virus was not only new to the US but also had the potential to cause a global health crisis. In the years that followed, efforts to better understand and contain the virus became a priority for public health organizations. Researchers worked tirelessly to develop diagnostic tests and potential treatments, while health officials focused on educating the public about how to reduce their risk of exposure. Despite these efforts, however, the hantavirus continued to pose a significant threat in certain regions, with occasional outbreaks occurring in areas where rodents were abundant. The lessons learned from the accidental creation of hantavirus are profound. They underscore the importance of safety and caution in scientific experimentation, particularly when working with pathogens that have the potential to evolve and mutate. They also highlight the complexity of viruses and the unpredictable nature of biological systems. The creation of hantavirus serves as a stark reminder that the boundaries between science and nature are not always as clear-cut as we might think. A small mistake, a misstep in the laboratory, can lead to consequences that affect millions of people around the world. While the story of hantavirus is a sobering one, it also serves as a testament to the resilience of the scientific community and humanity's ability to adapt to unexpected challenges. Over time, advances in our understanding of the virus and its transmission have helped to reduce the risk of outbreaks, and medical professionals are now better equipped to identify and treat cases of HPS. Moreover, the virus's inadvertent creation has spurred significant research into the study of zoonotic diseases, and has raised awareness about the dangers of viruses that can jump from animals to humans. But the story of hantavirus also serves as a reminder that we are far from mastering the mysteries of the natural world. While scientists have made tremendous strides in understanding viruses and how they work, the accidental creation of hantavirus shows us that we are still learning, still discovering, and still encountering the unknown. In the ever-evolving field of virology, what begins as an experiment aimed at advancing human knowledge can sometimes result in something far more dangerous than anyone could have predicted. Today, hantavirus remains a significant focus of research and public health efforts. In addition to ongoing work to develop treatments and vaccines, the global scientific community continues to explore how to prevent future outbreaks of this and other similar diseases. Although scientists didn't intend to create a deadly virus, the lessons they learned have helped shape how we approach virology and infectious disease research today. Ultimately, the accidental creation of hantavirus is a reminder of the delicate balance between scientific ambition and responsibility. It's a story that shows how progress, while essential, can sometimes have unintended and tragic consequences. As we continue to explore the mysteries of life at the molecular and viral level, the story of hantavirus serves as both a cautionary tale and a call to action, urging scientists, policymakers, and the public alike to proceed with caution, understanding, and respect for the power of nature.